Okay, now next let's see some common distal radius fractures or wrist fractures. Okay, the wrist fractures. Okay, so there are three main fractures that you need to remember. One is the uh, Colles fracture. Colles fracture. Then next is the Smith's fracture. Then next is the Barton's fracture. Okay. Barton's fracture. Okay, so basically all these fractures are fractures of the distal radius. Everything is fracture of the distal radius. So what is the difference? The difference in Colles and Smiths and Bartons, the difference is only in the orientation or displacement of the fractured segment. Okay, based upon the displacement of the fractured segment, whether it is dorsally displaced or volar displaced, based upon that these distal radial fractures are given different names. Okay, so that is the most important thing you need to remember. Okay, and so one code to remember, whether it is intra-articular or extra-articular, is remember that remember this code. This Colles is a dog, if you know, it's the most intelligent dogs type. Colles, border collie it is called. So Colles, they always like it outside, these collie dog, because they are very playful. So remember it is a remember the code as Colles dog likes it outside, and the dog's owner's name is Smith, but sorry, and Smith likes it outside only 85% of the time. Rest of the time, that is 15% of the time, he likes it inside. 50% of the time he likes it inside because there is bar inside. Inside his house, baby. 15% of the time he likes it inside because there is bar inside. So what this means is, Collie means Colles fracture. Colles fracture is outside, that is extra-articular. And Smith's fracture 85% of the time also is extra-articular. And 15% of the time it is intra-articular along with bar. Bar is Barton's. Barton's fracture also is intra-articular. And 15% of the time Smith's fracture also is intra-articular. So you can remember it that way. Okay, so Colles fracture, so now let's first see the similarity between the Colles fracture and the Smith's fracture and the differences. So the similarity is, like I said, both are extra-articular. Colles is extraarticular. Smith, 85% of the time it is extraarticular. Okay, and 15% of the time it's intraarticular, and this, when it is intraarticular, it is called reverse Barton. Okay, it's a trivia. 15% it's intraarticular, and when it's intraarticular, that is what is called as reverse Barton fracture. Okay, then the next similarity between Colles fracture and Smith's fracture is, like I said, both are distal radius fracture. Distal radial fracture involving the metaphysis. Okay, these both are similar. Smith's fracture and Colles fracture, both are similar. Okay, both are distal radial fracture only, involving the metaphysis. Those are the similarity. Then another similarity is both are mostly both are associated with ulnar styloid fracture. Okay, association. Both are associated with the ulnar styloid fracture. Okay, those are the similarity. Okay, now let's see the difference. The difference is Colles fracture is related. The difference is, as I said, it's related to the displacement of the fractured segment, the angulation. So this Colles fracture is known as dinner fork. It causes typical dinner fork deformity. It causes dinner fork deformity of the wrist. So in dinner fork deformity, what happens is the wrist will be somewhat like this. So see, this resembles a dinner fork, right? So this is a dinner fork. You can see a similarity between both. So the radius will be here, and here the fractured segment. This is the fractured segment. It has displaced to which side? This is the dorsal side, and this is the volar side. So you can see the displaced segment as displaced volar. Okay, sorry, to the dorsal side. Okay, there is a displacement of the fractured segment dorsally. That is seen in Colles fracture, whereas in Smith's fracture the displacement is volar displacement. Okay, so you can see okay, so in Smith's fracture it is volar displacement. So So that is the only difference. Okay, and the other difference is related to the in which age group it is seen. Colles fracture, the age group is in old age, whereas Smith's fracture it is seen in young age group. And so one important question is, if an old person with a Colles fracture, an old patient, old male patient with an X-ray, showing Colles fracture comes, what is the next investigation to do? What is the next investigation? What is the next step investigation? What is the next step investigation? So the next step investigation to do is a DEXA scan. DEXA scan is done to look for bone density and to rule out any osteoporosis. So, and the osteoporosis, if it is there, the treatment method is different. Okay, so that is about Colles fracture. And Smith's fracture, one thing is, because of this volar displacement, okay, because it is displaced volar, what happens is it is associated, can be associated with carpal tunnel syndrome. Because as you can see, when the fractured fragment is displaced volar, it reduces the space within the carpal tunnel, so it is associated with carpal tunnel syndrome. Okay, so now the next is the Barton's fracture. So now let's see what is in Barton's fracture. As we have seen, it is intra-articular. Okay, it is intra-articular fracture of the distal radius, and here there is classical Barton. The classical Barton fracture is like the Colles fracture. It is dorsal displacement. But most common fracture seen is volar displaced Barton. Volar displaced Barton is more common. You need to remember that. These can be asked for MCQs. Classical Barton is dorsal displaced. Dorsal displacement is seen while the common fracture is volar displaced Barton. Okay, and the hallmark of Barton fracture is radiocarpal dislocation. Okay, that is the hallmark of Barton fracture, and it is always surgically repaired. Surgery is always needed for Barton's fracture. Okay, so that is it. So the next fracture is the Schoffer fracture or Hutchinson fracture. The Hutchinson's fracture or Schoffer's fracture. Schoffer's fracture. So Hutchinson or the Schoffer's fracture, you can remember it using the code that remember it using the code Hutchinson the Schoffer. Hutchinson the Schoffer always drives always drives car with stylish radial tires. So the point is Hutchinson or the Schoffer fracture, it involves the styloid process of radius. Okay, it involves the styloid, it's the fracture of the styloid process of radius. Okay, another point is this is commonly associated with carpal dislocation, especially the perilunate type, perilunate and scapholunate. So that is the Hutchinson or Schoffer fracture. And one note related to radial tilt. What is radial tilt? A radial tilt is nothing but when you see an X-ray on the lateral, view, the radius will be having a small tilt. It won't be perfectly upright. There will be a small tilt from the center, and this angle is 11 degree. You have to remember. So the radial tilt is 11 degree. It should be a perfect lateral X-ray. So on a lateral X-ray, radial tilt is 11 degree. Remember that for the MCQs. Okay, so that is it.